Welcome to a Brookwood Baptist Health exclusive. My name is Brian Pavlik. Thank you for coming along. Thank you for using Brookwood Baptist Health for all your primary and specialty care needs. And so talk about specialty care. What about afibrillation? Yes, atrial fibrillation. It's going to come up in September as far as an awareness month, but it's never too soon to talk about it here in July. And that's why I'm with a great friend, Dr. Sandberg. She's an electrophysiologist with cardiovascular associates with Brookwood Baptist Health. Dr. Sandberg, good morning. How are you?
Hey, good morning. How are you? Thanks,
I'm
Brian.
good. Yeah, good. And it's going to be the 4th of July weekend. And, you know, sometimes when I know for dogs, when they hear fireworks, the heart kind of goes like this. But for some people, you know, it may give them a little jolt too. But that's, of course, during certain circumstances, kind of acute stuff. There are people who have long-term heart arrhythmias, and that's what you specialize in. And that's what we're going to talk about. So, Dr. Sandberg, if I'm at church, if I'm at the 4th of July picnic, if I'm just with my friends and family and somebody says, I've been diagnosed with AFib. Just make it basic for us. What does it mean? What does it stand for? And what are we kind of talking about?
Sure. Well, atrial fibrillation is a very common heart rhythm problem. It's an irregular heartbeat, and it refers to a specific type of arrhythmia. It means that your heartbeat is irregular. Some people have this all the time. They're in AFib, 24/7. And other people have it episodically where it can come and go.
Yeah. Is this something that you and your team, you diagnose at an earlier age? Is there a certain age that most patients that it comes from? Who's presenting to you when we say, okay, this is what we're going to be looking at?
Sure. It's definitely more common the older someone gets. So we see it more frequently, when people are in their 60s and 70s and 80s. But we do have a fair number of young patients. I have patients as young as their 30s who have atrial fibrillation. And it does seem that it's becoming more common in younger age groups.
Is this something that is more genetic? Are there lifestyle choices, or is it just a heart condition that appears as you grow older?
Sure. It's kind of a little bit of everything. There's no one size fits all when it comes to AFib. I have patients who have really no other health problems. And in those cases, maybe it is a genetic thing where they have family members who have AFib at an early age. But then I have patients who have a lot of other medical problems that seem to be related to it. As far as lifestyle things that you asked about, obstructive sleep apnea, which is, sometimes seen as a lifestyle problem, but also a medical diagnosis, that has a very strong association with atrial fibrillation. And I've even seen people who that's really their only risk factor for AFib. And once we treat their sleep apnea, their AFib becomes a lot more manageable. Sure. Other lifestyle things, obesity, definitely related to AFib. And then alcohol use, especially in men, it seems that moderate alcohol consumption really is associated with increased rates of atrial fibrillation. There's something called holiday heart. So you mentioned the 4th of July coming up, and one sort of type of AFib is something that happens to people after, maybe a little bit of too much celebrating over a weekend or something, and getting dehydrated, maybe a little bit more alcohol use than usual, and then having AFib after that. So that is definitely something that we might see coming up here this weekend.
I was going to say, we are getting into the back half of the year. There are celebrations galore, especially when you start talking about the holidays in October and November and December. And oh my goodness, you're right. And here you are talking about a younger person, sleep apnea. So let's see, I turned 40. I don't sleep really well. No, thanks, Dr. Sandberg. You're really making my day. We're doing fine. But it's good to know these things, because as we talk about, and we're talking with Dr. Sarah Sandberg. She's with Brookwood Baptist Health and an electrophysiologist with cardiovascular associates. For me, it's funny, we talk about an irregular heartbeat. Well, as you know, sometimes people just live with it where irregular becomes the regular. And they just say, oh, well, that's how my heart always is. And that's normal, regular to them. So instead of just judging by irregular heartbeat, what are some less obvious signs or symptoms that people may want to pay attention to? You talked about the sleep apnea and the obesity and all those good things, but are there any things that will happen to us that definitely are not normal that we may say, hey, we need to consider this?
Sure. Some people have kind of insidious symptoms from AFib. So they might feel a little bit more fatigue, maybe a little bit of shortness of breath or less stamina when they're exerting themselves. So if you notice that exercise or exertion that you previously were able to do becomes a little bit more difficult, or maybe you're out of breath a little bit more than you were, a couple of months ago, that can definitely be a sign that points to AFib happening. Some people have very striking, disturbing symptoms. Some people have chest pain. They think they're having a heart attack. Some people are lightheaded, sick to their stomachs. It's a really variable thing. And then about a third of patients really don't have any symptoms at all. So it can be very different for anybody. I think the main takeaway would be, if you feel like something isn't right, or if you're monitoring your heart rate on an Apple Watch or a smartphone, and you see something that's irregular, get it checked out. Not every irregular heartbeat is atrial fibrillation,
Right.
but AFib is so common and has so many ramifications for your health that if you have it, you really want to know about it.
Yeah, don't wait till September, folks. Check it out now.
Don't wait till
Go ahead, Dr. Sandberg. Yeah. Well, I was going to say just a couple more questions with you today, and I appreciate it. This is such good information because you're telling us what to look out for. You're telling us who it could affect and all that good stuff. So now just tell us the basics of, okay, I've either been diagnosed, or maybe I need to slow down a few things before I get checked out of a doctor, because we all want to make sure we diagnose ourselves and treat ourselves first before professional opinion, of course. What are some things that I can do today to start the process of maybe working on if I think I have AFib?
Well, besides getting checked out, which obviously is the most important thing, trying to have a healthy lifestyle. So moderate exercise, that's, getting about 60 minutes of exercise several days a week, or 30 minutes of exercise every day. Trying to stay at a healthy weight. So if you're overweight or obese, working on losing weight. And then really, reducing your consumption of alcohol. So for men, 2 drinks or fewer a day, and ideally not every day. For women, 1 drink or less a day, and trying to, again, limit alcohol consumption seems to be kind of the most, the things that can, I think, have the best effect on it right now. A lot of people come to me and they think that, oh, I really need to limit my caffeine intake. And that, honestly, that hasn't really been true, in the large scale. There certainly are some patients who are very sensitive to it, but overall, I think limiting caffeine isn't something that you need to focus on. Really, it's the healthy body weight, exercise, and alcohol.
We are coming up on the hour. You're going to have a patient here in just a few minutes, and I appreciate you just giving us a little bit of your time. So how do I eventually get to you in the patient experience? Do I pick up the phone? Do I say I want an appointment with Dr. Sandberg? Do I go to a cardiologist first? Do I even go to a primary care? What's the patient experience to eventually get to you as far as you treating my symptoms for AFib?
Sure. Any of those are possible avenues. So if you have a relationship with a cardiologist and you have been diagnosed with atrial fibrillation, it's a great time to ask about it and say, hey, I have this in my history. What are we doing to manage it? Am I getting the best treatment options that are available? Some people are just on medications for a long time, and by the time they come to me to consider, a procedure, it's not as great of a chance of success as if they were coming earlier. But I have patients that come to see me on their own with no previous cardiologist, or plenty of patients who are referred by their internist or family physician. So any of those options are available. But I think the most important thing is, if you're feeling symptoms, or if you think that you have this as a problem, get it checked out, and we're available to see you. But the first step is getting a diagnosis.
Get a diagnosis. Go see Dr. Sandberg. Go see some of her colleagues at CVA. Just go see some of our wonderful physicians within network and also associated with Brookwood Baptist Health. We are here for you. As you can see, not only she is a wonderful doctor with a tremendous expertise, she's personable, she's friendly, and she knows what she's doing. So, Dr. Sandberg, I just appreciate you. We've rescheduled a few times, but you made some great time for me today and educating everybody today. For everybody who's watching this, your heart cannot wait. Your heart health, listen to it. I mean, it's telling you things. It's speaking to you. If you feel it's wrong, go see somebody like Dr. Sarah Sandberg. Dr. Sandberg, good to talk to you. For everybody else, we will see you soon on a Brookwood Baptist Health campus.